patient in this position for every motion palpation, good leg and bad leg, okay? So we'll say that Pranav's having problems with his right leg. We're going to come over here. Just like this, you're going to start here. Whatever the bone is for your motion palpation, right? Then you're going to come around to the good side. Now, you don't have to do the whole motion palpation scheme, only the bone that we're interested in. So if it's a talus, you'll motion it like this, right? If it's anterior and medial, you'll have some problems this way. If it's anterolateral, some problems pushing it back here. If it's just anterior. If it's gone posterior, you'll feel a little drag when it's coming out this way. Okay? Everybody got that? Then you're going to come over here, find the navicular tubercle. You're going to stabilize the talus, and you're going to grab the navicular, and you're just going to move it up and down. That's all you're going to do. Okay? Everybody got that? Then you're going to come down, stabilize the navicular if you're doing the first cuneiform, and you're going to move it up and down like this. You can just do it like this on the navicular if you want. This, I think, helps you to understand more what you're doing, but either way, I'll accept it. To do the second cuneiform, you're going to come down, you're going to follow this down. Make sure you know your landmark. You're going to be just distal to that. You're going to grab the second cuneiform, then the third.
You're still
Just
stabilizing
move it up
the
and down.
navicular.
Still stabilizing the navicular and the cuboid in this first row. Okay? First row. To do the proximal fifth metatarsal head, you got to stabilize at the cuboid. Move this up and down. To stabilize and motion the cuboid, excuse me, just the motion of the cuboid, you got to stabilize the calcaneus. So you're going to grab onto it like this. Okay, have your patient roll away. Put your fingers like this and move it up and down. So your index finger goes on top, thumb goes on the bottom. Everybody got that? To motion palpate the calcaneus, you're going to have the patient sit upright, stabilize as much as you can into the talus, and you're going to do this figure 8 type motion. Okay? Okay, wherever the bone is, the restriction is going to go from the line, the point of misalignment to the point of correction. Okay? When you're motioning the distal metatarsal heads, you're just going to push them up like this. Individually, just pushing them up. Okay? Remember, always do the good side. I don't think there's any more bones that we've worked on anyway. I know there's more bones. Okay, if you're going to adjust the talus, thank you. You can have the patient with their foot just barely hanging off the table, or you can rest them like this, is fine. You're going to make your adjustment through your chiropractic index finger way up on the talus. You don't want to move down at all where you're on the navicular or the cuboid, way up on the talus. You're going to put the patient's foot into dorsiflexion, traction, and thrust with the scoop. Okay, if it's gone lateral, you're going to use a little bit of eversion when you're doing this, and you're going to change your line of drive, thrusting it this way. If it's gone medial, you're going to change your line of drive and thrust it this way. Okay? Everybody got that? We'll do it posterior, and we do the posterior calcaneus. Okay, now, we're not going to have you do any of them, but any one of them that goes superior, you just grab it and yank it down. Okay? We're not going to do those. But, this is the one I want you to know for your navicular. You're going to come up under the navicular tubercle, a little drop inferior and medial. You're going to come up underneath it with your thenar. Grab onto the foot this way, not like this. Grab it like this. Come up, open the joint, thrust it. The first cuneiform is the same thing. Right here, you're just going to open the joint a little differently, thrust it up. Okay? Okay. We'll do those ones. Prone. Let's see. The cuboid, you're going to come around to the side. You're going to wrap your fingers like this around the calcaneus. And with the same hand that you're wrapping around the calcaneus, you're going to come up underneath the cuboid, up underneath the volar surface of the foot. Take the foot with your hand this way, the dorsum of the foot with the palm of your hand, and you're going to put it into plantar flexion, or maybe even plantar flexion with some eversion. Thrust it out. Okay. If you're doing the distal metatarsal head, you're going to grab onto it, you're going to traction it, and you're going to thrust it up, whichever one it is that needs to be adjusted. Okay? Everybody got those? Okay, if you're gonna do the distal fifth metatarsal head, we'll use your left foot on this one, bring your foot up here. The way I want you to do the distal fifth metatarsal head is this way, with your thenar on that. Grab the person's foot, again, your foot, the palmar surface of your foot is gonna be on the dorsum of the palmar surface of your hand is gonna be on the dorsum of the foot. You're gonna put it into dorsiflexion, and you're gonna evert it and shove it. Once you get your liner dry, rest it back down. Okay? Everybody see that? Okay, make your contact here. Take the foot, dorsiflexion, eversion, and shove it down. Okay? Can we get him some headrest paper?